The vessel Eaubonne arrived from India on Sunday and has since been under lockdown. The Transnet National Ports Authority says it's tracking and tracing 41 people who boarded the ship on Sunday to offload cargo, mainly rice imported from India. Authorities say one of the 14 Filipino crew members with COVID-19 was rushed to hospital.
This morning we picked up that one of the 14 had breathing difficulties and he has been rushed to hospital, meaning there's only 13 people that are now on board the ship who are positive. They will be quarantined for 10 days in line with the protocol regulation. If nobody else takes ill, then after 10 days the ship will be free to proceed with what they were here to do.
The cases have ignited concerns about the possibility that crew members are carrying the B1617 variant. The variant has been reported in 17 countries, including Germany, Belgium, the UK, Switzerland, Singapore, Fiji, and India. According to experts, mutation is a natural occurrence in the life cycle of any virus. However, multiple mutations threaten to create a virus that is not only more contagious and potentially deadlier, but one that can also evade a vaccinated body's immune system.
It is expected that we will see different types of variants because mutations are happening all the time. But I think the concern is when we see variants that are more transmissible or highly transmissible that we have to pay note to. And of course, because they still travel across the world, these variants are going to move to different places. The only way really to combat these variants is to make sure that we can stop transmission of the virus in all parts of the world. So the first thing that's important is to make sure that there is equity in vaccines. You can't have one part of the world getting vaccinated and another part not getting vaccinated. We've got to make sure that everybody in the world is able to have access to vaccines.
Research shows that this variant could be more transmissible than the one found in South Africa.
I don't think that because we are seeing a much negative impact of a variant that was circulating in the UK, that we should then take the one that we had here in South Africa for granted or take the one that we are seeing in Brazil for granted. So even the one in India, we should not take it for granted. But it is highly unlikely that it is more transmissible than the one that we are seeing in South Africa. If it is, it's probably around 20% based on what we have had so far.
He does not believe that South Africa's borders need to be closed.
I think that should the infections start to increase, then I may change my mind and then suggest that we increase restrictions, including borders. But for now, I think that we just have to continue with the precautions that we are continuing with. If we adhere to the regulations as they are and continue with the rollout and continue with the surveillance that we are doing currently when people arrive and so forth, we should be fine.
In a statement, Health Minister Zweli Mkhize said that while B1617 variant circulating widely in India had not been detected in South Africa yet. Genomic teams were working on samples to determine whether South Africa had been impacted. Jade Paulser, SABC News, Durban.